I'm Dr. Gary Churchill at the Center for Facial Plastic Surgery. Eyelid surgery is a great way to take years off your face and make you look rejuvenated and refreshed. One of the first places people see their face aging is in the eyelids. One reason the eyelids age earlier than the rest of the face is because the skin is thinner there and is more prone to damage from the sun and other environmental factors. Here at the Center for Facial Plastic Surgery, we do both upper and lower eyelid surgery. The technical term for eyelid surgery is a blepharoplasty. When we do the upper blepharoplasty, the first step is that the crease is marked at about 7 millimeters up from the eyelashes. Then I pick up the excess skin that's hanging over the crease and I measure it to be sure that the patient can still close their eyes. So this is a very important concern of mine, and we're very careful how much skin we remove during the surgery. Upper blepharoplasty can be performed with both local anesthesia or it can be done under twilight anesthesia. Either way, we do inject local anesthetic under the skin so that the skin is totally numb and the patient doesn't feel anything during the procedure. Upper blepharoplasty takes approximately half an hour per eyelid. Once the skin is marked and numbed, then we remove the excess skin. Beneath the skin is fat, and the fat can cause bulging as well and can also push the skin out, which is one of the causes for the excess skin to hang over in the first place. So we want to remove some of the excess fat so that it's a lifelong procedure that really doesn't have to be repeated ever again. Because the upper blepharoplasty incision is in the crease, there's no visible scar once it's healed. The sutures come out in 5 days, and the bruising and swelling is usually resolved in approximately a week to 10 days. Because upper blepharoplasty is performed here as an outpatient, patients go home quickly and the recovery is fast. This is not a painful procedure at all. Most patients report that they have little or no pain. When patients come in for surgery, they often tell me that they look tired and haggard. And after the surgery, there's a big difference. They look more wide-eyed, youthful, and very refreshed. When patients come in for lower eyelid correction, what they're usually seeing is puffiness and what they call bags under the eyes. Lower eyelid surgery is done here in the office as an outpatient, and it's a fairly quick and simple procedure that can make a huge correction in someone's appearance. Lower blepharoplasty is performed under twilight anesthetic, and typically the fat is removed that's causing the puffiness under the eyes. In addition, the tissue is tightened once the fat is removed so there isn't excess saggy tissue under the eyes. And the best part is once the fat is removed, it really doesn't return. So this is virtually a permanent solution to that problem. The incision is made directly under the eyelashes so that when it heals, you can't see any detectable scar whatsoever. Once the incision is made, the skin is elevated and the fat is exposed beneath the muscle. Then the excess fat is removed with care not to make the eyelid look hollow. The incision is closed with dissolving sutures, and then I look at the contour of the lower eyelid. In the lower eyelid, dark circles are caused by two conditions. One is the puffiness of the fat that's actually in the orbit, and the other is hollowness that's over the orbital rim beneath that fat. So when we do a lower blepharoplasty, we take out the puffiness by removing the excess fat, and then sometimes we put fat back in over the orbital rim to fill that area out. This technique eliminates the dark circles under the eyes and makes a smooth cheek to the lower eyelid transition, which is a much more youthful look. With lower blepharoplasty, there's very little pain and you can cover any bruising and swelling with sunglasses, so patients typically can go about their normal daily activities right after the surgery. Most people do experience some bruising and swelling, and it can take 2 weeks to 3 weeks for that to completely disappear. People's eyelids age differently, so some people come in and just do the uppers, some do just the lowers, and a lot of people do both. And in addition, a lot of times we'll do laser resurfacing on the skin around the eyes to get additional tightening and smoothing effect. Because blepharoplasty is an easy surgery to undergo and has a quick recovery, it is the most common procedure we perform at the Center for Facial Plastic Surgery. I've done thousands of these procedures in my lifetime, and when you're choosing a surgeon, experience is really important. So you should trust your face to a facial plastic surgeon.